Hi everybody, I'm Davide Mantia. I own a small business in Palermo, gestionedati.com. That means data management. And today I'm going to present you the project I'm most proud of, the Totem. I called this project Totem because the most visible part of it is a kiosk, and because it is a vertical application. Okay. My customer is the Casa di Cura Macchiarella. This is a healthcare facility that provides different services. The one of the more critical service is the radiotherapy, and we wanted to improve the delivery and management of this critical therapy. First, by improving the patient comfort, then making it easier to manage a large number of patients every day, and finally, by automating accounting and billing. What I found in the facility at the beginning was a radiotherapy application manager that manage the machines that make the therapy, that do the therapy to the patients, and the accounting and managing application, and of course, Microsoft SQL Server already. So what I developed are 3 Microsoft Access applications. One main application for the queue management and other services that I'm going to describe you. The Kiosk application is a Microsoft Access application, and the reporting application for accounting and billing, and 2 small services, an IP socket interface application for the international standard interface, IP socket interface, HL7. The HL7 is an international standard for healthcare facilities and machines that I'm going to describe you. And for informational displays, we choose to develop a small application in C# because they are not interactive. So the system is an integrated system of applications, most of which are Microsoft Access application and 2 small applications in C#. The Totem system is then integrated with other systems in the facility, communicating in both way with other applications. With the Mosaic application, Mosaic is the radiotherapy application, where doctors schedule the patient's therapy. We used an HL7 interface. For accounting application, we developed a proprietary interface with the 30-party software house. The first challenge was to develop the HL7 protocol interface. So we developed, the service that performed the IP socket communication, and Microsoft Access translate a message for reading data, organizing it in the tables. Here we see the main mask of the Totem system. Here in the bottom right corner, you see the trial icons of the IP socket interface. 3 rows green up. The system is working. This is the control panel of the IP socket. It has 3 channels. Each one has a referring row in the tri icons. and so staff can check that the communication is up. Briefly, I will show you the HL7 message. Not so important, but this is a sample of the message. Is a text-based delimited layout. This is the structure of the message. This is the structure for scheduling new appointment, table samples of the protocol. This is the structure of the financial transmission message for accounting for the HL7 protocol. We developed the interface with the accounting application, and the result is a set of applications working all together on the same SQL Server database, communicating with each other through the tables, the data on the Microsoft SQL Server. Okay, this is the waiting room. Because why it is important? This is important because to enhance patient comfort, we wanted to calm down the patients. They are in a critical situation, and so we wanted to create a situation where they feel that someone is take care about them. The first thing that they found when they arrive is the Totem or Kiosk. I will talk about the Kiosk later. Okay, we have then the queue management. I will describe it better. And we have the financial reporting application that each month generate a report for accounting and billing. This accounting is double checked with the accounting application. Okay. To understand how this system is integrated in the facility and how it works, I created some imaging to show you. Okay. Here, let's try this way. Okay. This area represents the radiotherapy application. This area represents the Totem application. When a doctor creates a therapy for the patients, a schedule therapy, the radiotherapy application generates a message for the interface. Then the interface generates an HL7 message for our interface. This message is saved as it is in the SQL Server database, and the main application reads the message, translate it in the HL7 tables, and then it generates data for the working table, the patients, registry, queue, and sessions. This is for the radiotherapy. For the admission, when a patient arrives, a prescription is loaded in the administrative application and is sent to the Totem system, to the main application. This is because the system generates a queue for any therapy, not only for radiotherapy. So this transmission generates a queue for the patients that is arrived for other therapy different than radiotherapy. When a radiotherapy patient arrives, he registers himself in the Totem, and as well, this arrive is registered in the main application. The main application then transmits the arrived patients to the radiotherapy application so that the staff can prepare the machine to irrigate the radiotherapy. And the Okay, here you can see that the queue manager show the weighted patients for radiotherapy. At this point, the main application generates the queue for all therapy, including radiotherapy, and the queue manager show arrived patients. When the staff perform the calling, the call is transmitted to the displays through SQL storage procedure, and the queue manager shows that the patient has been called. The patient entered the radiotherapy. The radiotherapy is delivered. And at this point, the radiotherapy application sends back as the completed therapy. The completed therapy is used to generate a table for all sessions of radiotherapy ready for accounting. Okay, the data transmission for reporting follow the same strategy. As I said, the prescriptions are sent to our application. Radiotherapy sent, I would say, therapy completed via HL7 interface. Sessions and prescriptions are sent to the reporting application. The reporting application compile prescriptions with the session actually delivered, and all the stuff, actual therapy, are sent back to the accounting application. The accounting application generates a report for the regional office of healthcare. This report is imported in the Totem system and double-checked for any missing. The result of this system is that we managed 36,000 therapy in 2019 with over 100 therapy per day, of which 36% radiotherapy 1, because the facility has 2 radiotherapy machines, 31% radiotherapy 2, 18% radiology and ecography services, 8% physical examination, 7% clinical analysis. Okay, the first thing I'd like to see inside is the Totem, because initially we wanted to buy a commercial Totem, but it was very expensive, more expensive if we needed a printer, as you can see here, and a barcode reader, card reader. So I decided to make it myself, make it by myself. Here you see the monitor, and if you look with attention, you can see that this is a Microsoft Access application. The mask is open with the dialog option, and in this corner bottom at the left, you can see 2 small green squares. This tells us that the printer and the barcode reader are online. If one of them is offline, one of these small squares became red. Okay, this is the design of the kiosk. I designed it in 2 versions, a wider version and a slender version. This is me with the cartoon model. This is the skeleton during the construction of the kiosk. The process of construction. Here you can see the monitor with the PC behind. Okay. This is a dressed totem. Here in the facility, the installation process. Okay. Everything, the wiring inside. The setting up in service. Okay. Well, the first thing is that the main mask show a different button. All these buttons are already in the structure of the mask, and the buttons are shown when services are enabled in the SQL Server database. At the moment, we have 4 services. Here you can see the totem at work. Now I'm going to show how it works. The first selection I will do is simulation for radiotherapy. Is a scanner procedure for targeting. In this case, the totem print a ticket. If okay, for die. Okay. Sorry about that. Okay. This is for simulation targeting the radiotherapy. Okay. If the patients select a different service, the totem answer displaying, okay, this is the ticket printing. If the patient select a different service, the totem tell the patients that he already have a number because at the admission they receive a number. For the patients of radiotherapy, because they are already scheduled, they can insert the therapy number that they already have, and the totem will register their arrival. Okay. Okay. The vocal message has a calming effect on the patients because the patient understands that someone is taking care of his arrival. And so he sit and wait very quietly. Another way the patients can register is by showing his healthcare code to the reader. It's the same procedure. Okay. Here, some sample of the coding of the kiosk. This is the mask structure. As you can see, all buttons are already in place. And you can see this figure is this picture. And this picture shows the patients that they have a number when they are admitted at the entrance of the healthcare structure. So the printing of the ticket is not necessary. In the center, you can see a QR code. This is for further utilization. I'm developing double channel communication with the patients. The patients can show his healthcare card to the reader, and the Totem can answer with a QR code that send him to a PDF file on the internet or similar. The communication with the barcode reader is via communication port RS232. Of course, the keyboard emulation has been disabled because it's not good for this reason. The COM port is checked on the timer event of the form, because you never know if the communication goes down. So I check every cycle and I open it if it is closed. Then I recheck if it is open. And if it is not open, this code make the small square at the bottom red. Okay, this is a storage procedure that load the patients in the queue. Okay, all this code manage the scrolling of messages on the Totem screen, because it is able to scroll messages from the staff to the patients. And this function here, status Totem, just load the state of the Totem in the SQL Server database for the control panel that I'm going to show later. Okay. This was scrolling. Okay. This code is on unload event. This code cancels the closing of the mask if a patient click on the closing icon. And because I need some time to close that mask, there is a sequence of touching on the mask that I can perform to force the closing. But usually the mask never closes. This is the ticket, the kiosk print is an ordinary report, because the printer has a driver, and the report is just resides to the paper format, 58 millimeters wide. Okay, other important thing in the system is the informational displays. They can show multimedia on the left, right, and the last 5 number called in the right side. Here, a sample of the calling. Okay, because we have different waiting rooms, each totem is configured to show the calling from the service that is managed in that waiting room. This is for radiology and so on. Okay. This is the queue manager application. We see the menu form here. Sorry for the Italian names. I'm going to translate in the next images. Okay, these are the waiting rooms for different services: radiotherapy, radiology, echography, and clinical analysis. Okay, this is the queue manager. As you can see, each patient is indicated with his therapy, radiotherapy, physical examination in different colors, and the status of the patients is in different color, weighted. Okay. Green is arrived. Okay, sorry, but okay. Let's do vocally. Okay, this is arrived, green. This is completed. This is cold. Red is waited. Okay, this on the right is the control panel where staff can check that all players or informational displays and the kiosk are online. If some problem came up, they can restart the PC that manage that peripheral. This is indicate peripheral status. Here we see the transmission logs of the interfaces and the server status. Because this application is installed on different PCs, one of these application is server application, the other REST client. But if the server application goes down, another application becomes server. We have a fault tolerance. On the top right, we have the services enabled, highlighting red where a patient is arrived and waiting. No highlights, no patient has arrived. We have an interactive help. Sorry for Italians, I had not the time to translate all this, but staff can activate the help and see what each button does. Okay. Okay. Each button apply a filter on the mask. Waited, arrived, cancelled, closed, all patients. External patients, hospitalized, admitted, hide the register. As you can see, hide the names of the patients for privacy reason. Help is a help, and so on. This is the registry mask, and this is interesting because patient's registry is not manually loaded on the Totem system. The Totem system received registry from two sources, the radiotherapy application and the accounting application. And because each patient has a unique tax code, the Totem system just correlate the records from one source with another source. But sometimes, because of an error in the data entry, a patient can be duplicated. In this case, in this case, we need to eliminate the duplicated record. This procedure is automated, and we can just insert here the tax code and click correct duplicated, and the software automatically will eliminate the duplicated record. Okay. Okay, this is the code that eliminates the duplicated record. Okay. And here we are to the reporting application. The reporting application is the end of the procedure. Okay. And we have reporting, files, load flow, month report. Each month, this application generates a report for accounting. Okay. By clicking reporting, this mask is open. Here, doctors load therapy details as diagnosis, goals of the therapy, radio dosage, and so on, and then send this report to the administrative office. Okay. The administrative office open the report and just find actual therapy and prescribed therapy. By clicking on prescribed therapy, the application will select automatically the corresponding actual therapy delivered. So the operator has only to check the date and accept by clicking associate. Clicking associate, the therapy are linked to the prescription. As you can see here, residual therapy are 0 because all are compiled. If necessary, manually, date can be changed manually in this tab, where we see the compiled prescription. At the end of the process of selection, because this process is repeated for each prescription, the operator just click send, and the compiled prescription are sent back to the accounting application. If a prescription is not delivered, the operator can just click cancel here to cancel that therapy from accounting. Okay. Once all this is sent back to the accounting application, the accounting application monthly generates the report for the regional office of healthcare. This report is imported back with load flow. This load back the flow generated by the accounting application, and a report is printed. This report is a check flow of the transmitted therapy with the therapy in the flow for regional office. Here, what is important is the presence of this 1 in each column. As you can see here we have a missing 1. This means that this therapy is not contained in the flow for a regional office. This is an error that administration have to check, because each missing therapy is money. Okay. I wanted to show you something. Well, all this. Okay. Of course, everything is sit on the Microsoft SQL Server, and what I'm going to do is implementing temporary tables for data safety, because to avoid involuntary deleting of therapy, patients, and so on, actually is great problem, and I managed this with triggers. A problem is the growing of this database. So performance are always on the focus, and I'm going to migrate the SQL Server on a virtual machine to have a better control on the situation, backups, and so on. Well, what we obtained is to manage completely this service, and the customer was satisfied of the system and asked us to extend the control of the queue management to all other services in the structure of the healthcare facility. Thank you all. Thank you, Carl, for your invitation. Thank you, Peter, for hosting. And if there are any questions, just ask.
Yes, Davide, there are a few questions. One is, how do you handle unstable network? So like access is not responding. That's not fun to display a message like this on the kiosk.
Well,
doesn't it happen?
Yeah. Well, okay. When the Microsoft Access application over the kiosk crash, or when make an error, it just automatically restart. And this is a feature I inserted, but well, the system went on service in June 17, never stopped. So I trust I have trust that it is working fine.
Okay, another one is, how did you get this contract to develop the system? How does an Access developer get such a contract?
Well, I were lucky to have the trust of the CEO of the structure. He believed me when I said I can do this.
So personal relations.
Yeah.
Another thing is, I think you didn't mention that the display or the monitor actually speaks to the patient.
Oh, sorry. Yes. Okay. I can show it better.
And how is it done? With which technology?
Oh, Microsoft technology. Okay. Okay. The informational display is here. Okay, what the message say is the number and where the patients have to go and the color of the area where the patients have to go. Because each area...
We didn't hear your audio from the PC.
Okay.
Can you turn it on? Would be interesting. Okay. Only if it works easy.
The audio, you didn't hear the audio of the video?
Mm-hmm. We didn't hear it.
Okay.
Now we hear something. Yeah.
Okay. Do you hear?
No.
No. Okay.
No audio.
I think you have to do it with sharing your screen. Can you go to the share screen? And
Okay. I'll do that. Okay.
You have to go to the screen sharing of Teams, and there you can click on include audio.
Okay.
Do you see it?
Okay. Include audio. Oh!
Exactly.
Sorry about that. Okay.
può accomodarsi nella sala visite alle avere.
Okay.
How did you do this?
Okay, this is C#, and the audio generator of the operating system of Windows 10. So you didn't add Totem, okay? I'm so sorry about that. Okay.
Does
Here,
it say something? You can go back and show it, yeah?
okay, I'll show it. Okay.
Codice 190. Il vostro arrivo è stato acquisito. Accomodatevi in sala. Verrete chiamati al vostro turno.
Okay, this is Microsoft Access that speak to the patient, and this vocal message has a very calming effect on the patient. And this what you see is the manual registration of the patient, but the patient can also show his healthcare card to the reader, as you can see here.
Il vostro arrivo è stato
It is the same thing.
Accomodatevi in sala. Verrete chiamati al vostro turno.
What the voice say is your arrival has been acquired, has been registered. Just have a seat and wait. You will be called at your turn. And and so we obtain a very calm waiting room. And okay, and I don't know if you want, I can show you how the voice of the Totem is generated.
Show it.
It's Microsoft Access application. Okay, I'm going to show you.
Just curious, is the voice available in English?
Yeah, of course.
Excellent.
Okay, include the audio. Desktop. Okay. Do you see my screen?
Now we see it.
Okay. This is the Totem application. I'm going to open in without start. Okay. Macro. No, macro no. Okay.
It's very blurry, so we can't read it. It's not very clear, but maybe you give us an impression what it takes to get.
Okay, speech. Okay. I take the function. Okay. This is speak. The speak function is embedded, and you can write what you want.
We can't read it, but just to get an impression if it's a lot of effort, a lot of code, or just speak as it does.
Just speak. Try to write speak in your code.
For your information, Gerrit just pasted a function in the chat that does the speak.
Of course, yes.
A lot easier to see.
Yeah. Ecco qua.
So it's just a create object and send it something.
Okay. Let's try this on your Access application. You can alter the speed of the message. The second parameter is the speed, and the third parameter is the volume. Do you hear?
Ciao a tutti.
Okay, you can try this. Is inside Microsoft Access. I found it. It's very easy to use. Okay. And well, what I'd like to explain is that all the code of the kiosk is on the timer event, because the button event is not enough to manage all these processes. The reading of barcodes and the printing, all this. And okay.
Davide, what you have in the background in your room, is it the model of
Okay. Yes.
Show it.
Okay. Okay. Okay, this is the model, the cartoon model.
So you
I
really
realized,
built it. You built it from scratch. It's really all
yeah,
yours.
yeah. This I made this to check the 8 because I wanted to realize a kiosk for low people and taller people. So this 8 is ideal to use the touch screen and printer, reader, and so on. The barcode reader are coded in the BBA, and the first version of the printer was hard-coded because it was a serial printer, but now I updated it with self-cutting printer. You can see here it is different. This is a self-cutting printer. Okay, I don't know if I was clear that patients for therapy different than radiotherapy, as radiology and so on, the queue came from the accounting application. At the admission of the patients, the accounting application sent me the arrival of the patients with the number the accounting application gave him.
There's another question. How much time did the development take for all this?
3 months.
Oh.
3 months. Not so much, but well, I'd like to describe the situation. Before my intervention, patients just arrived and knocked on the door of the radiotherapy room to announce their arrival. There was a lot of confusion. Help me.
Confusion, yeah.
Confusion, and they were called by the staff with voice. The staff
There was no privacy.
Who's the next? Well, this is just a queue manager, but I integrated it with automatic accounting for regional office, and so it is grow in its complexity.
Can you compare the cost or commercial system? Do you know? Because you have done all yourself. You have done it with Access. Normally, we are very cheap. A commercial system would have cost them much more, I think.
Well, the first thing is the kiosk. If you try to buy a kiosk, it costs about 3,000 or more, and maybe
euros. You're talking with euros.
Yeah. Euros, and you don't know if you have the printer and the barcode reader. I spent less than 2,000 euro, 1,800,
I mean, as a whole, the whole system.
The whole
You have-
system, the printer, the reader, the PC, the
Yeah.
touch screen monitor, and the construction of the structure of the totem.
And your time, include that, Davide.
And my time, of course. But it was diciamo entusiasmante.
You liked the work. You
A
Yeah.
hobby.
were enthusiastic about it. Yeah.
Yeah, the result is a very good result, and Carlo, come si dice, mi ha portato a vendere estensioni, aiutami.
You now can sell enhancements
Extension,
for the system. Extensions,
Enhancement,
yeah.
because
Yeah.
the system was born with one waiting room, and now we have 3 waiting rooms and other
And
systems
And soon
all
we will see your
connected all
totem
together.
all over the world, maybe.
all over the at the
Okay, I
moment,
think
not so.
We are at the end of the time. I think personally, I think this is very impressive, your work here, what you
Me
did,
too.
all the integration and the building part and so on. Thank you very much, Davide. Thanks.
Grazie
for
a
the
te.
presentation.
Thank you. Grazie.
See that.